Microphones are here on the table. And what you brought with us is this small hat. What is this hat all about? Professor CISSÉ, tell us more about this hat.
En fait, la forme.
This hat, okay, I'm just going to show the hat. The hat is the device through which you can have EEG. The EEG is a specific examination through which you register the electrical activity in the brain. It is standardized thanks to what we call a 1020 device. So you have electrodes on the hat, and so it's applied on the skull. How does it work very concretely? Should I place it on my head?
On peut le faire.
Well, go ahead. No. No, unfortunately, I think I'm not too good with that. I'm afraid of what you're going to read. Are you going to read my brain? Read my mind? Is it going to vibrate? Is my EEG flat, or is something still happening? You know, at the time of the day, maybe there's a few things happening there. There are a few things. Okay, so what we do is, can you speak in the microphone, or we can't hardly hear you? So then you apply this gel in order to have the right impedance. Okay, I don't want more gel in my hair. Anyway, so you apply that to have the right connection. When it's connected to this tablet. Then you have this 1020 device. What is a 1020 device? So this is a standard protocol which was developed 80 years ago, developed by Dr. Jasper in Canada. This is the same system that you use the world over, so that it is reproducible and also inter-exchangeable, so that what you do in Guinea or in Boston is the same thing. Okay, so this is a hat. Looks very simple, but it's a true revolution for you who need to have EEG and get data, especially to detect epilepsy. Today, EEG, you need to have someone in the hospital. You need to have an expensive equipment. Sometimes patients have to travel hundreds of kilometers. A child, that family, to be detected. There's a high cost to that. Well, yes, it's very expensive when you go the conventional way. On average, for transport, it's 10 hours to see a neurologist. In Africa, we have a ratio of less of one neurologist per inhabitant. We discussed that this morning already. And you have very few countries where they have more than 10 neurologists for the entire country. Now, this is the only examination through which you can register the electric activity of the brain. I was an internist in Europe, but then when I went back to my country, you have to know that epilepsy is a more widespread disease, and I had no EEG when I went back to my country. So you have symptoms that are reported to you by the patient, but without EEG, it's difficult to select the right molecule, the right drug. So for me, in collaboration with our friends from Boston, this is a major plus. EEG is more accessible. You know that in a French lab, it takes only 1 hour to have an EEG. This is reduced by 2 with that device. It's more easy to use for nurses, but also for patients. Because if you need to apply an electrode according to a pattern, it's quite complicated. It's not so straightforward. So it reduces the cost for the patient, but also cost of the device. You know that if I want a pro forma from a major company, it's about 10,000 euros to have such a device in a clinic, while this device is about 300 euros. Right, so you cut from 10,000 to 300 euros. So it means that you're going to reach out to more people. I know that you pay a close attention to epilepsy, and maybe not everybody in the room is aware that epilepsy today is a major disease in southern country. Why is that? Well, there are many reasons. As a reminder, 60 million people live with epilepsy, 80% in countries, in southern countries. So this is certainly not neglectable. Also, there is another mortality, an increased mortality in developing countries compared to other countries. Okay, and so as an extra piece of information, so 80% of those people are in southern countries. For which reason? Because there is neonatal epilepsy, infections. So infections that are contracted during delivery can be malaria, can be HIV, can be also Ebola disease, and this can trigger an epilepsy fit. I know that there is also a program around car accidents. You have to know that when you went through a car crash, it may triggers a lesion in the brain, and because of that, you're going to have epilepsy. Stroke creates ischemia, hemorrhage in the brain, and because of that, you may suffer from epilepsy. Also, there are genetic reasons for epilepsy. So when you have inbreeding, if you will, when you have those sorts of reasons, you may have epilepsy. Okay, so 80% of patients live in the south, and you also said that neurologists are very few in the countries of the south. So you're going to reduce the cost for those patients. You're going to help more people. So you say that you studied in Europe. Is it in Europe that you heard about this project that was developed by your team, Farrah, MATEEN? You work at the Harvard Medical School. What brought you to this device, Farrah?
So this device was actually invented not for medical purposes, but for video gamers.
Comme quoi?
And it was developed by a team at Danish Technical University in Copenhagen. And so video gamers are very interested in their brainwaves. And so I found this group online. I said, well, I'm not sure that you can actually read what people are thinking, but it'd be great for epilepsy. And would you be willing to give it a try? And lo and behold, they were. And as Professor Abbas just said, most African countries have about one neurologist per million people. And what this would be is a point-of-care device for patients with epilepsy versus having people come into the hospital.
Est-ce que je suis quand même très surpris des chiffres que
I'm
l'on
very
donnait, 10 000
surprised
€
by
pour un
those
EG
figures,
classique, on arrive à,
10,000
je crois,
euros
500
for
€
a
chez
conventional
retenu pour
device
un
and
EG avec ce bonnet. Est-ce que l'on a la
300
même
for this hat.
fiabilité
Is it as
scientifique?
reliable from a scientific point of view?
Right, so the traditional EEG system has 32 head leads, which means there are 32 stickers on your head which can trace brain waves. And this device has fewer leads, so it's 14 leads, so you have some reduction in what we call sensitivity. So that would be one trade-off for a cheaper system. Nonetheless, we've done several validation studies. We've recruited more than 500 people to date, and it looks like the sensitivity is still adequate. So EEG is a very old technology. It's only very recently that we've been able to create a point-of-care operation for this. So I think there are some refinements that still need to be done. I don't think this is a perfect system. However, it's an open source system, so this is a free app. The only costs are really the headset and then having a tablet, which is just a traditional Android type of tablet. And 300 euros might even be an overestimate of the cost.
Qui est aujourd'hui capable de...
Today, who's able to use this hat? Who can use it? Obviously, we heard that we have too few neurologists and you want to reach out to more patients. So do you need to be a medical doctor? Do you need to be a nurse? Or can a regular person use that hat? Well, you don't need to have a specific training. A nurse, a qualified nurse, can place a hat. They can use a tutorial, online tutorial, and then they can they're good to go. They can already use the hat. Now, the data are sent to a neurologist, and it's a neurologist who's going to assess those data. Now, those devices also are good in that sometimes we have power shortage in our countries, and with such devices we are less reliant on that. It also helps in our country for other conditions when you need to decide whether you should resuscitate patients. So it could be used in resuscitation departments. When you have a flat EEG, then people are brain dead, and then you should avoid invasive resuscitation measures. Well, Professor CISSÉ, we see with a device, the tablet and the heart, we realize again that technology has reached a level of maturity which is sufficient to have this remote examination. So you're going to have those data on screen. Now, I think that the problem lies with social, cultural acceptance. How do those populations accept this device? Is it another way for you to raise awareness when it comes to fighting epilepsy? Well, you're right. Also, it removes stigma. The problem with epilepsy in Africa, most of the time people think that they are under the influence of the devil, or they think that people are mad, so they can be the source of many persecution. Now, it helps in diagnosis, but it also helps in acceptance. Epilepsy is a very severe condition, and so patients are really keen on finding a solution. And most of the time, the solutions that they have at their disposal is not sufficient. And this device, if we manage to scale up the implementation, I hope will help in attracting those people to a medical treatment. And when it comes to acceptance, I think we can learn from the experience of others. Maybe we could have religious authorities on board. We are a very religious country. Now, when Professor MATEEN visited us in our country, in Guinea, we realized that when she was available, we had so many people who wanted to see her. Again, epilepsy is such a severe condition that they are really looking for a solution. So I think that acceptance will be certainly made easier. Well, we try to transition from something which people think is related to the devil or to someone being mad to something that can be cured with medicines. And that is wonderful. In this framework, what are the benefits of having this partnership with an American university? Does it raise the profile of your project?
Yes, I think that credibility is an important word, because when, especially in Africa, when you have experts, so it's a kind of a buffer, right? The Americans represent, yes, if an American university comes to talk about this disease, they say it's not the devil, it's just a problem in the brain. So today we do have treatment, so I think that really makes it quite reliable, what we do in neurology. But in addition to epilepsy, because of course Africa has a strong prevalence also in cardiovascular, so it's not just neurological diseases be more accepted, and people understand that the medical treatment is a better choice than what other alternative practices. So another theme which is linked to the overall theme of the day, you see that the tech side really works. We said that the patients have to also be the ones asking, and you said that is the case in your country. One last person is the governments, the policy makers. Do you have their ability to really embrace this project in your country? Well, I think that 100% of the people are okay with it. We do have to try. There's a big problem in Africa why the government is not always there. We need to have a positive mindset. The patients are there. They want, there's a goodwill, then there's a lot of foundations. We've tried, but we will. Yes, I think that the government is a big problem in our country. Now, do we influence on them? I can't answer that. Honestly, I think that we need to increase the awareness, and I think maybe the ones who will have most influence are the patients maybe more than us. Of course, we have access to the health ministry. We have seen the general secretary of our health ministry. There was a lot of yes, okay, but then will we really see things happening. I think that I'm a bit mixed on that. Farrah, one last question. What is the usefulness for a university in America with the Harvard Medical School to cooperate on this kind of project? What do you expect from this project?
Right. So it's been a real privilege for me to work with the people of Guinea. And, I think I'm like many people in sort of the global north who go into medicine because they want to extend beyond their local communities all the way to places like Guinea. So it's really an honor to do so. And when I go to Guinea, people start lining up at midnight to come and see me the next morning. And so I try to see as many people as possible, but we can't do that by ourselves. So we need great partnerships and great foundations that support these partnerships. And so I think, this is the real honor of being a physician and to be a researcher, is to try and drive the field forwards and to do it with enthusiastic and passionate champions.
Bravo, félicitations en tout cas.